and there's a staff.
Yes.
The staff also have one here, and that's why you brought me here to come and see.
Yes.
Is that not the point? Meanwhile, it's not accessible to the patient.
No, it's only accessible when the taps open.
So
that's the so for a while now, water hasn't been flowing in there. And that's what I wanted you to see. You see that there are sachets. People enter there and they use sachet water and then just dump it there. And that's the situation.
please, even if it is not being used, you can't clean the place and lock it.
There's no water.
No, so you can clean the place and lock.
There's no water to scrub the place.
You don't have water to do anything. You can make arrangement for the tankers,
yes.
the tankers to bring water, and so you don't have that arrangement. Dr. T, you are telling me that you can't have water for this place to run this facility.
No, we get
This is Dr. Valentine. He's the HOD of the emergency. And one night we didn't have water at the emergency, and he himself got them to get the yellow barrels to come and bring water for the nurses to work. So at our level, sometimes my HOD does his best.
Yes, I agree. And I'm the first person to admit that there are challenges with respect to water in Tamale. But that's why you're a leader here, that's why you're a CEO here. Not until we resolve the issue completely. I've been on the committee for a very long time, and we have always been talking about this. And we think, we know that you have a way of providing water for the facility until we solve the issue permanently. And that is what you have been briefing us. We know that the Tamale water challenge goes beyond the facility. It's well known in the country and all that. But you cannot tell me that, because if you are not very careful, people come here and pick the diseases from here and go home. That's what it is. And you know, you're a medical doctor.
Yes, sir.
So they will come here because there's no water. The person is sick. He comes here and picks the disease and he goes with the disease because there's no water.
So we have then two. They want to hold they are allowed to 4 trips. That 4 trips alone cannot dialyze take care of the dialysis unit for a day. Because when you open one dialysis machine, like you open a tap. So the 4 tankers a day is not enough. So when the water can we prioritize, we have the public toilet that we have for patients. So if this one is locked, then they'll use the public one. It's outside one, built by GMTC. So maybe on the way we will go far. The only is a bit far from here.
No, but I've come because of you.
Even the minister, you should look at the way you are behaving in front of me. So you can imagine how I'm trying to explain. You can imagine how you
I'm trying to be
how can you behave like this? So it means that you're doing worse things here. It means that you're doing worse things here.
Boss, please. Honorable, please.
I mean, you with your superiors, look at how you are arguing. There's a problem here. So if a commoner comes here, can you imagine what how can somebody talk to this man here? How will he be able to communicate with you? How will he do it? There's a problem.
That's the Minister for Health there. Not so pleasant sight, if you ask me. Kabna Minta Kando with the CEO of the former CEO of the Tamale Teaching Hospital, and also the Member of Parliament for Tamale South, Tamale North, why do I keep saying South? Alasan Suhini was clearly not happy about the turn of events, and it raises some serious concerns as to the quality that people get when they get to some of these state-owned facilities, the hospitals that is. It had to take, so the question on my mind, Helen, is this. No, find me the other one. There's the GMA other one, the Tamale Teaching Hospital doctors. They had put out something that they need, right? Some things that they need. They're talking about constant flow of water through the taps for clinical work. They're talking about stable electricity supply in the hospital. They're talking about constant supply of oxygen, provision of consumable items such as gloves, gauze, cotton, face masks, cannula, sutures, syringes, disinfectants, glucometer strips, plaster, etc. They're talking about constant supply of reagents to ensure continuous stuff. They're talking about MRI machine, they're talking about a CT scan machine, they're talking about mammography machine, fluoroscopy machine, C-arm machine for the main theater, ABG machines in all intensive care units of the hospital. they're talking about 2 mobile X-ray machines. The question I ask myself is, so they knew that all these problems existed, and they had to take the Minister for Health to come there on a surprise visit, literally get him into an altercation before they actually voiced out that we need all these things. Ventilators. Look, I am gobsmacked. So how were they delivering the health, the health good to the people? It's a question that we must ask ourselves. So the hospital was without all these things, or is without all these things. It had to take a Minister of State to come to the place on a surprise visit to see how dirty a washroom was. When he complained about it, he turned out and then say we are on strike because we don't have all these things and we are managing. Maybe I don't understand English. Maybe you people do.
Maybe this isn't the first time that they have.
Helen speaks English.
Let's just speak it.
I was going to ask. Maybe this is not the first time that they have made these demands, but this is we're privy to it now. A lot more information is needed. For me, I don't like how that interaction went between the health minister and also that wasn't the CEO, was it? That was a doctor.
No, that was a doctor
who works at the
I understand
facility.
he's a specialist
neurosurgeon or emergency response.
In fact, one of the lady doctors said that's he's the head of his department.
Yes,
so he's head of the
head of
department for whatever he specializes in. I thought the conversation at the start was going okay. I mean, it was a bit of a ping pong. You say your own, I say my own. They were having dialogue.
She's speaking ping pong. All this under
just to
table tennis.
Create the analogy in a more visual way. For me,
picturesque.
Where the conversation, I don't know. It didn't have to degenerate to the place that it went to at all. There was no reason for that. I did not like when the minister conclusively said, "This shows how he treats his patients." I thought it was personal.
The minister, and I said it this morning, that the minister may have spoken with a lot of hot blood.
Yeah.
But also picture this. Auntie B walks in here and is telling us that, why is the studio this, why is that? Then we start talking back and straight away, you are grandstanding the Minister for Health, who has left his office in Accra because somebody died in your hands. And the relatives in Tamale are not happy about it. And they are threatening to take serious action against you, some legal, some physical, whatever it is. The minister says, look, this should not happen. The doctors were doing their job. Let me go there and see for myself what is happening at Tamale Teaching Hospital, which is why this could not happen. He gets there, he's asking questions, wants to understand. He doesn't work there, he's not a doctor. And then the responses that are coming is like give and take, you know.
You see, Johnny, that's why this morning
I'm coming. So you see, the minister, for example, spoke about the washroom, and I'm very particular about it. Look, this morning, if you check the Johnny's Bite stream, and you check the comments of people who live in Tamale, I say, the minister, what he did was just a tip of the iceberg. People who live in Tamale, I go to Tamale very often because I'm a small chief in Tamale. On the ground, you will not like it. So if I had gotten the minister in my corner like that, and I were at the hospital, I would have taken the opportunity to sell him these problems. I wouldn't have waited for some sack or suspension or whatever it is for me to come and write this and say we are on strike. I would have told him, Mr. Minister, we appreciate that you have come. We condolences to the family of the person, we lost and all of that, blah, blah, blah. But Mr. Minister, you see, in the face of the circumstances, we are trying our best. For example, we don't have a CT machine, we don't have ventilators here. You enumerate that and you let him carry it and bring it to Accra and come and solve it for you.
I think that's what the doctor did. That's what the doctor did. And bear with me, I just want to talk about the sanitation thing. Apologies, Sixtus. When the issue about the no water came up, there was a lady doctor who was in the mix.
Right.
And she says, this is my head of department.
Right.
Sometimes he himself will bring water
yes.
on his own volition.
Right.
You know what it's like when you are behind the scenes as a worker. You're breaking your back and the higher ups sometimes know or don't even know what you are doing to seal certain inefficiencies. I can understand in a way from the perspective of the doctor that you have come in, and he said it more than once that okay, had we had this equipment, he said it.
We wouldn't have.
He said it calmly twice.
Yeah.
And so after a while, if you've been dealing with something over a period of time, we all know the feeling. You'll be thinking, hey, Masa, it be me where I did here. I know the inefficiencies. I use my own resources to bring water here. You come from Accra. Maybe you're not well furnished with some of the nuances. Yes, there could be issues. You would get your blood hot.
You see, in the region, there's a medical director, right? The CEO at the TTH is not the final authority for all things medical in the region.
Right.
He answers to somebody. Now, the minister...
Does he answer to the medical director, regional?
Yes, he has to. He has to answer to somebody. He is not the monarch of all his affairs.
No, I know. I'm just trying. You know, a lot of these facilities are autonomous.
Yes.
So Kolebu, for instance, I'm not sure. I don't know.
Right.
I'm not sure whether the CEO of Kolebu, for instance, answers to the regional director of health.
I don't know what their structure looks like, but I'm not sure that he is also standing alone.
No, he definitely would be reporting to somebody, but I'm not sure at the regional level.
Now, the person you are to deal with, the minister, and I want us to appreciate this.
Right.
So this is quite unconventional for a minister to move from his office to say, I'm taking a surprise visit. Usually the visits are announced, they are planned, scheduled. You know, you clean everywhere. He comes, he sees the thing is okay.
There's a DEBA.
Yes, a DEBA, staff DEBA. Yes. But this minister says, no, I want to come and see things. I'm walking into the facility. And if you know Minta Kando, he's been doing that. When I did the renal department expose at Kolebu, he just sprang up on Kolebu, and he's had his own set of troubles with, other facilities where he gets there, and there is literally being told to get off there because he was in opposition. Well, now he's in power. So he says, look, I'm taking a surprise visit to the facility. He gets in there and he sees at first hand bush, he sees baller, he sees untidy place. He certainly will be worried. Is this what my people are benefiting from? Is this what they are being served with? It's a simple question. And I'm not sure that any doctor will be told that administer health in a dirty space. Any doctor worth his salt has been trained to say administer health in a dirty place, or nurse. The place has to be clean. This morning there are people who call and say, I went to Dubai, I went to this place, I went to that place. The level of hospitality and care, duty of care, clearly was absent. The water problem is just one of many. You heard one of the doctors saying, I think the CEO saying that, look, they order 4 tankers of water, and even that is not enough. They order it for essential services. So if you order 4 and it is not enough, what do you use your IGF for? Why can't you order more? Why can't we sink a borehole? You don't need the central government to be answering basic questions. That's why you are there as a manager. So if the manager now becomes a messenger, is complaining, you are not fit to be a manager.
Johnny, I'm saying...
Are we talking about the doctor or the CEO?
Helen,
I'm putting all of them together.
That is one of the problems.
That is the problem.
It is not a problem.
It's a big one.
We have to separate the issues. The doctor's problem is different from the CEO's problem. And this morning I attempted doing that, but because we didn't have time. Surprise visits are normal. When you want to catch... Then, a lot of information is coming out of this place about this, the head of the institution, or about even work culture, behavior. In our own space here, it happens. There are times that I am aware that one of our bosses comes around on weekends.
Yeah, you come and show.
Unannounced visits. They come to see you, Helen, you are not here.
Yeah.
We know these things. And I know he listens to us every morning, so he's hearing what I'm saying. So it's a way of also monitoring performance, delivery, and efficiency, and all of that. It's not a crime. It's not an offense. Johnny, indulge me, I beg you. Now, when you go on such a visit, there's a reason you are going.
Right.
What you do in the public space should be different from what you do closed doors or behind the scenes.
Right.
Now you walk into Tamale Teaching Hospital. Probably because you have heard a lot of things about the place, you want to firsthand ascertain for yourself.
Right.
So you walk into the facility. Definitely, there'll be some shock. Oh, CEO is not aware. CEO is sitting behind his desk, and somebody runs in. Hey, Minister Bao. Then, you are all panicking. That is a normal reaction. Right. Now, there will be a point at which the CEO would definitely have to conduct the minister around the facility to say that, Crosby, this is the unit. It's a maternal and child health unit. Crosby is the head of unit. Crosby, this is the health minister, is here to visit. Then Crosby will say, Minister, welcome. This unit, over the period, these are the challenges we've been having. But beyond the challenges, this is what we are doing. Then Helen is head of pediatrics, something. Right. But there will be some of the conversations that will be held behind closed doors.
Right.
And that conversation about somebody has died and how care and management was either appropriate or not appropriate should have been held closed doors. You can't come, I'm standing there, I'm the doctor, and it's as if I'm being blamed for the death of the person. Mind you, there are legal issues involved here. The family probably is contemplating suing the facility.
Right.
We don't know.
Right.
The family is probably saying that, this one, the doctors tried. Given the situation, the doctors tried. So let's let it go. The family probably says that, we understand the challenges, but the doctor could have done better.
Right.
These are all, experiences that the family would go through. And those experiences would then inform the family's action going forward.
Right.
So, health minister has come. The thing about they don't have this machine, those machines that the doctor was mentioning. If you go to this statement, they don't have anything.
Right.
If you go through the statement released by the doctors, it means that the hospital has nothing.
Then the hospital should be shut down. What are they doing there? So what are they doing then, taking salaries at the end of every month?
So this is where CEO will come and minister is asking CEO, how did we get here?
They say they don't have gloves,
teaching hospital
masks,
doesn't have these
oxygen,
things.
water, gauze, plaster.
Even the basics of the essentials, they don't have.
Yeah, but I'm saying that you are the biggest referral hospital in the region. So the minister is right to ask you, how have you been operating?
I'm not disagreeing.
So now
I'm just saying
you see
when you have that conversation in the full glare of the cameras, there and then people will take a certain posture. Because I don't want to be blamed for the death of somebody when I know that it is not my fault.
Alasan Suhuyini, MP for Tamale North, was there. And I would say this again. On the ground in Tamale, when you go there, the reviews about the Tamale Teaching Hospital is bad.
So that speaks to leadership.
Now, it's bad. From Niku to Motri to everywhere is bad. You don't get anybody saying anything nice about them. Those who say nice things, they will try say nice. By the time they finish the thing,
they've landed somewhere else. They spoil the matter.
The matter spoil because the matter is not good. Now, if I'm saying again that if I, given the PR that you and I we learned in school, if I had the opportunity to meet the minister and I was the leader of the hospital, the leader is trying to be a politician. There are two politicians, first of all. Let's get it right. Alasan Suhuyini is a politician.
The doctor is not.
I'm coming. Alasan Suhuyini is a politician. Minta Kando is a politician.
Yes.
The doctor is not a politician.
He is a
technocrat.
Yes.
Now, there are two politicians who have come here.
Yes.
Whether for public show or to do their job.
Whatever interest.
Or to get their base to know that, look, we are interested in or whatever it is. That's on their side. It is up to you to keep your cool. If you notice, the gentleman who was consistently answering the question in the blue-black top.
Yes.
At some point, he started fuming.
Yes.
Because he thought that there were too many questions that were coming.
He repeated himself too many times.
And I'm saying that...
He's the doctor. He's the head of the department.
Yes, but the minister is not getting the answer he's looking for. Mind you, the minister didn't come there alone. There are TV cameras following him.
That is my problem.
There are people who do...
What you're saying is that if the minister wanted the answers...
He should have gone into a closed-door meeting.
What else did he want to hear?
The minister would have more information if he sat with the CEO and the head of the department in a closed-door meeting.
After
when you come out,
see the place.
After you've gone around, you've seen the place, you've heard all the stories. Like you said, the people themselves know the problems with the facility.
Right.
So after you've gone through the facility,
You would have
you
seen
have
some
seen
by
the
yourself.
problems.
Yes.
You've seen it yourself. Then that interaction should not have the cameras there. Because once the cameras are there and you know us, Crosby,
The motive becomes very different.
it becomes different.
That's
and
true.
everybody will adopt a certain posture that,
I'm not
you want to
responsible,
blame me
it's
for
not
this,
me,
but
I'm
it
not-
is not
yeah.
me.
That is why even after the doctor says to you, not once or not even twice, that we don't have this. And I've watched the video many times. He
Right.
was measured. The doctor was.
The
He says we
doctor
don't
was
have this.
measured.
I don't think the
Until
health
you
minister.
said getting to the tail end of
Yes.
it, then he started because he was saying the same thing over and over and
again.
over, and he
like
kept
he
saying
was
that
not listening.
the solution is very simple and straightforward. If you heard him,
Yes.
he used those words. It's simple. It's straightforward. Because as far as he is concerned, as a technocrat,
Right.
These
if
are
we have
problems
A, B,
that can be
C,
solved.
D will happen. But if you don't have A, B, C, D cannot come. And there's no way you can jump D and go to E. That's the scenario he
So
was on.
so now the doctors say they are on strike with their counterparts, right? It had
Which
to.
again is also,
I'm coming. It
is
had to,
also,
so again, if you
it's
genuinely
too much.
want to fix the issues,
It's too much.
right? Genuinely want to fix the issues, we didn't have to take the Minister for Health to come to the place
So
to come and issue. I'm coming to come and issue. You get a problem with
Yeah.
him, and you come and say we are declaring a strike.
That is what I'm saying. That it's
The
too
people
much.
on the ground,
It's too much.
they have felt the, for want of a better expression, the
The wrath of the
they have
of the situation.
Look, they have felt, they have gone through it. If indeed the hospital doesn't have all these things, the people have gone through it. Some
They've
have
lived it.
died through it. Some have survived it. All these things not being available. They didn't think that it was necessary at the time to go on strike. He had to take a confrontation with the minister when they came to the reality came out to the public before they went on. Somebody called this morning and said, look, he broke the leg, went to the Tamale Teaching Hospital. They say morning doctor will come and take care of you. Morning doctor can say night doctor will come and take care of you. He was lying there with a broken leg. Then another called and says, look, my child is at NICU, the neonatal intensive care unit. In fact, the message is here. Let me find it and read it so that people don't say I'm making this up. And it didn't make sense for them to go on strike for all this time until the minister came. I find that problematic.
You know who the minister should have had that back and forth with? The CEO.
But you see, the CEO was in white.
That is
The
it.
CEO was in white and it was.
Because the problem now is that you've gone and pissed off your doctors.
Your doctors.
You had the tete-a-tete with the wrong
The
person,
wrong person.
and now the,
The people who are not
conversation
responsible.
So
Yeah.
that is the problem. If the minister had that tete-a-tete
all
with the
these
CEO,
problems
all these
that we have
problems,
talking about,
then
it's
we would
a
have.
pure leadership problem.
In fact, what I see right now is I would wish that the former CEO, he would come out and then maybe in a statement tell us how he has engaged the health ministry since the NDC government took office, since the health ministry
No, not
took
even the
office.
NDC.
Just so,
not even
I'm
the
coming,
NDC.
I'm coming.
Let's go back to the beginning of
So
the problems.
that we
What
will know
steps or
the
actions has he
attempts
taken?
he has made to solve the problem that has still not been solved. That we'll know who is responsible for the problem still persisting, so that the blame will either be on him to warrant his dismissal, or the blame would be on government to ask questions as to why you knew this problem all this well, but you still refused to
Kept
solve
quiet
it.
about it.
Exactly.
Because
And then
if
when
these
you do this
problems were
public
there,
show-
Right.
he would have written memos about it.
Yes.
Those memos should be traceable. We should be able to find them in a file somewhere at the ministry level.
So we know he
we
did
know
all
that
he could.
he did all he could.
But it was another body that refused to do their job. And then we'll get to know the motive or the reason what motivated the health minister to go there with the cameras,
Right.
to go and put up what we are calling the show right now. Because as it stands, it's not too nice. The optics is not,
No.
too nice.
See,
at all.
At the end of the day, I'm not sure it is in the thinking of the Minister for Health and Alassane Suhuyini, who is a member of Parliament for Tamale North, that the doctors should go on strike.
At all.
No, that was not what they said.
And I'm not sure that the doctors themselves wanted to go on strike. This strike is in protest of their colleague who has been shown the exit.
You are mixing it up
Wrong.
again. It's in protests against the disrespect shown their colleague doctor. They are not fighting for the CEO.
Who they think is not responsible for
In
anything.
fact, they have not
The wrong
mentioned the CEO
person. That's what I'm saying.
anywhere.
I wish the tete-a-tete was with the minister and the CEO. Then that one we have those two clear issues that
But
you
see-
are in charge.
but
But
you
the
see-
wrong
but
person
you- but-
entered the ring
but
and
you-
has pissed off the doctors.
But you see, again, when you go to these hospitals, the heads of those departments, they hold on. Look, a case in point is the former CEO at Kolebu, right? Our friend who runs the plastic surgery department. He was running 2 offices. He was CEO of Kolebu, and he was also the head of the plastic surgery department and Ben's department,
Yeah.
which is in public administration wrong.
Yeah.
Because the plastic surgery department boss answers to the CEO, but he is the CEO, so he answers literally to himself. So he can sit down and write that, oh, we need 200 gloves, and then he will come and sign here that approved as CEO, right? Which was, but we know, literally that was what happened.
Let me help you. So you sit on this chair,
Yeah,
write
say,
a memo.
I need
come round
200
the
gloves.
table,
They
sit,
come and sit here
and
as
then
CEO
approve.
and approve. So you approve your own memo and your own request.
It's just like the former forestry commission boss.
Hey,
Sir
John.
He donating
The forest forever.
and go and thank himself for receiving it.
You know, so the point is that most of these heads of department, they hold on to the department. Like, I mean, it's Dr. Srebo. How long has he been at Cardiothoracic Center? He's held on to it, right? Dr. Mpoma, he's held on to the plastic surgery because he said, I set it up, I modified it, blah blah blah. So they hold on to it. So
It's my baby.
So you will get why the CEO of the TTH would have literally distanced himself, even though it was not the best thing to do. He literally slightly distanced himself from the emergency, and emergency department because he thought that, well, this man is the one who runs the day-to-day activities there. So if there are any questions, let him answer. You see where the confusion gets.
I pulled up the organogram of the Ministry of Health, and
Right.
we're talking about who the teaching hospitals would report to.
Right.
So when you go to that, look at that organogram, you have the health minister.
Okay.
You have an advisory board to the side of the health minister. You have to his right hand side, you have agencies. They name it agencies.
Right.
Then under that, just directly beneath the advisory board is the deputy minister. Then the chief director comes in. You have internal audit. But my interest is in the agencies.
Right.
And under the agencies, you have Ghana Health Service, you have teaching hospitals, Center for Plant Medicine Research, Food and Drugs Authority, Pharmacy Council, Psychology Council. So all of those ones come in. But you see that the teaching hospitals are considered as agencies.
Agencies,
So
right.
the management would respond directly to the minister.
Right. And this is the minister before you.
And this is the minister before you.
Who you are supposed to be responding to, but he has come to respond to
He
you.
has come, no, he has come to ask you.
Yeah, but because you see, and that's why for me, I don't know, but clearly I didn't like the way things played out.
At all.
I didn't like the way things played out. And I also think that, look, in our country, this is our country, people don't like public show. If there's something wrong going on, I'm saying to you, ask the people in Tamale. This washroom matter that we're talking about, that the CEOs, the people bring sachet and come and use it, it's been there for a very, very long time. In an hospital, when we know that people can pick infections. Look, ladies are more susceptible in these washrooms than any other person. They pick all manner of infections, and they will take you some more money to treat it. It will take time. If you don't take care, it will go to affect your womb. And the doctors say these things all the time. So if you have a hospital where you know that you have a lot more people coming in and your washroom doesn't look good, and you don't have water flowing, people take sachet and go and use there will be a problem.
Of course.
And if the minister talks about it, the minister doesn't need a tete-a-tete to talk about this. This is public conversation. Everybody should know why
Then
you are maintaining a hospital that doesn't have water, that people go into the washroom and go and do whatever, and the place is left dirty. We don't have to have an inside room conversation or behind the camera or in camera conversation.
We need to. You see, it's also.
This is a public conversation. I'm telling you.
No, but how you manage that conversation matters. You think that
you
the
manage
minister,
it?
Yes. You think that if the minister had sat down with the head of department, the doctor, what's his name again?
Dr. Valentine.
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 You think that if the minister had sat down with Dr. Valentine, Dr. Valentine himself wouldn't have expressed some frustration about the management of the facility?
He will complain
This is
about his
somebody
boss.
they say-
Remember,
of course,
the
it is
hospital has
possible.
a board as well.
It is possible.
No, I'm coming. Let me
It
land
is
on this
possible.
one. It is possible.
Okay.
This is a doctor.
I beg you,
Everybody
hold on.
in
I'm-
his defense
I'm-
is saying that he uses his own money
Yeah.
to do things for the hospital.
Oh, the support for
certainly
Dr.
he would also
Valentine
have
is
some-
crazy.
But you see, look, I have a nurse friend who listens to this show. She works at Kolebu, and look, she uses money from out of her pocket. I'm not sure the CEO knows about it. I'm not sure even the head of department knows about it. There are many nurses and many doctors,
There are
many
people who
teachers
do
who
that.
do that on
Yes.
our own. Me and you.
Yes.
People have come here. They are
Yes.
looking for school fees and on our own.
Yes.
We don't come and say it,
Yes.
but it doesn't mean that is
But
what.
not when you are talking about management and administration of a public
So
facility.
if the manager is not good, sack the manager. The manager has been sacked. What's the problem?
I wish Dr. Valentine had said,
You are
over
still
to
mixing
you,
the issue.
CEO. I
You are-
wish
see, Johnny is still
I wish
mixing
Dr.
the
Valentine
issue.
had said, when they asked him, he should have just said,
Over to you,
over to you,
CEO,
and then
answer.
kept his mouth shut. But now, because of that interaction with the
No,
doctor,
because he felt compelled because he was
Who
also
call
there.
Hoko here? Then
he
who
should have
sent
said,
you?
after he said it
there.
one or two, and he saw he was losing his cool, I would
should
have
have
advised
just-
Doc, say, Doc, say, over to you, CEO. Everything. No, honestly, he should have said everything he got asked. He should have said, CEO,
over to
please,
you.
over to you.
But who sent?
CEO, over to you.
But who
CEO
sent
answer.
Dr. Valentine to answer?
Then it became
But
a
he's
tete-a-tete.
also head of the department.
That is what I've been saying
He's also
since
head of the
time immemorial.
department.
That they hold on to the departments. Their heart is there.
Exactly. But you
So-
can't blame a man for
but-
being
No, he
passionate
should have- he
about
should have
it.
said,
I
CEO,
agree,
please
blame a
answer.
man
I
for
agree
his
with you.
passion.
So if your heart is there and you take the praise, if the bullets are coming, show that it.
No, if the bullets are fairly discharged.
Please, this one, it was open. We all
But
saw the
even
video.
if the praise is coming, he will not take it alone.
In fact, he won't even take it.
It's not for him.
so
It's
No,
for
he
the
won't even
management
take it.
of
That's the
So
thing.
they should share the
If
bullet
there was-
together.
If it was a question of praise, the head of department would never have been mentioned.
The CEO
They'll
come
say,
and
oh, the
collect it
hospital is
himself.
doing well.
Okay.
Or they'll say, oh, CEO, you are doing well.
Let's talk to another man who is doing well. Christopher Mwako is a man in the northern region and Savannah regions. Christopher, good morning.
Good morning.
What are people saying in Tamale about the Tamale Teaching Hospital?
Yes, the commentary coming from the public here in the northern region in general is not a good one for the Tamale Teaching Hospital. One has to do with the issues of management, management not having control over what is happening at the facility, management not putting in much effort to ensure that quality health care services are delivered at the hospital, management not also ensuring that the rights of patients and patients' relatives who come to the hospital are taken serious. Now, they are also talking about attitudes of some staff of the facility who, when patients report to the hospital, their approach and attitude to them is not the best. They are also talking about the fact that politics should be taken out of the management of the Tamale Teaching Hospital. It appears every household in the greater Tamale metropolis has had an experience, one or two, of how the management of the hospital has not been the best. From the management level to the staff level to the last person at the Tamale Hospital, the public is against how things are happening here at the hospital.
Chris, I see. Now, the doctor in question who's come under fire, that's Dr. Valentine.
Yeah.
Has you shared some thoughts? What are people saying about him as well? Share with us.
Okay, so Johnny, what I can say for a fact is that the commentary coming from the people around is that Mr. Valentine is a good person. He's been supportive. He's always gone out of his way to ensure that patients and patients' relatives here get the best of care that they want at the emergency unit. They also say it was unfortunate that he was in the center of this whole controversy. But I overheard Ellen say that he should have thrown it to the CEO when he realized that the matters were becoming somehow heated. But the truth is that after that time, the CEO, I must say that the CEO, it appears he didn't have much information about happenings at the hospital. And so when we visited every unit, the head of the unit had to do the explanation, and they were contradictory explanations, and the minister himself said that he is not happy that on one hand the head of the unit will give a different account and management also give a different account. He wasn't too happy about the contradictions, and he told the CEO that it does appear that he's not on top of the issues at the hospital.
I see. Now, again, the families that are hurt by the death of one of their own, Salim, the 31-year-old, what have they also been sharing?
Yes, the family has decided to stay off making any comment on that matter. All they say is that the treatment they received at the hospital wasn't the best. Because when they arrived, even though the doctors tried all they could to manage the situation, but the level of communication wasn't the best. And the fact that the teaching hospital, that is the major referral center in the entire north, and including Bono East and other parts of the Bono region, not having a ventilator to move a patient means that the hospital doesn't have any business running. And so even though they will not make any public comments about it, but they believe that the hospital needs to be reset.
And then also the sacked CEO, has he been talking?
He's not said anything yet. All we see on social media is some of his supporters coming to say that sacking the CEO would not solve the problems of the hospital because the new person coming in is also a political appointee, and that when he comes, he's also going to dance around the main issues and nothing will happen.
Let's go back to the hospital. While all this back and forth was happening, I'm sure that people in Tamale were also concerned about the state of their biggest referral center or health center in the region. Again, you said that the people are not too happy about the turn of events. They are not happy about the quality of service that they receive from Tamale. But beyond that, what else have they been saying? Doctors are on strike as we speak. What's the mood in town?
Yes, Johnny, I must say that I'm currently at the OPD of the Tamale Teaching Hospital, and people have come, they are seated, and there are no doctors to attend to them because they have withdrawn even OPD services. Now, the fortunate thing, Johnny, is that yesterday when their release came out in the night at the accident and emergency unit, there was no case reported. There wasn't any serious case referred to the facility, and so that is the good news. But I can also confirm that when I got here, I saw a family move relatively a lot here at the hospital into a vehicle to go, as to whether the person came over the night and because doctors were on strike, so they could not attend to the person, or the person is an inpatient. That I cannot establish because the people I have met here have decided not to make any comment about the happenings here. But generally, the mood of the people here isn't the best. Patient relatives are saying that already there is a situation, a very big challenge that the hospital is faced with. And if doctors are withdrawing their services again, then it means that the hospital, even having patients coming here to seek healthcare services is just something that isn't the best.
This hospital washroom, have you seen it yourself, or is the minister exaggerating?
Yes, I actually entered one of the washrooms.
What does it look like?
It looks terrible, Johnny. Very, very terrible. And that was why the minister had to, as it were, vent his anger on the state of the washrooms at the hospital. He is saying that yes, the management are blaming it on the water crisis in Tamale and the fact that they don't get water to maintain these washrooms. But the minister said that is not an excuse, because if you don't have water, you make sure that it's in good state, then you lock it, because you said that you have an alternative washroom that the patients and patients' relatives use. And so he thinks that the water crisis shouldn't be an excuse, because they have water tankers that they go to fetch water to run the hospital. And so, Johnny, I must say that the washrooms situation isn't the best at all.
In closing, Chris, let's talk about alternative health delivery systems for the people of Tamale and beyond. Do they have alternatives at all now that the TTH, staff say they are on strike?
Okay, so for government aspect, the alternative is equal to zero. But private, yes. Why am I saying government aspect, the alternative is equal to zero? You remember the issue about the Tamale Central Hospital that we reported, where we talked about the fact that the hospital is nearing collapse, and the medical superintendent of the hospital also equally admitted that because of their issues with health insurance authority, they are unable to even buy consumables. Even here at TTH, patients' relatives have to go and buy consumables before they attend to patients. The West Hospital is also equal to zero. And so when it comes to government facilities as alternatives, it is zero. But when it comes to private facilities, there are some two private facilities that people go to, and that is the only alternative available.
Chris, I thank you very much indeed for your time, and we pray that the doctors may rescind their decision or will rescind their decision. But we understand also that the minister is set to do some donation out there in the northern region. It's not done in our country, yeah? Are we not? Issues.
3FM Sunrise.
Ameni, Anyamaza, Anyaoza, Asasi, Anyaoza, Nanyamaza, Asasi, Inti, Somo, Sama, Namasuma, Samina, Yakobo, Amenaya, Ghana,
The best in the morning is on 92.7 Sunrise on 3FM.
Yankano power, Yenjumem, Nayefina, Sangane, Pakamatuza.
3FM Sunrise.
Religious leaders, Sawaya,
And that's the situation out there in the northern region. Chris just tells us the story. So we know now that the minister was not exaggerating about the washroom, and I am particular about it. Look, this morning I've given some listeners and viewers on Facebook and on TV who watched us earlier on Johnny's, but I've given them a simple assignment. Go to any hospital of your choice, public hospital of your choice. Ask to use their washroom and bring me the feedback. That's all. And you will see that the story cuts across. Look, there may be one or two, that, may pass the mark and may have nice washrooms, but generally, it doesn't look good. And I'm concerned about it because it is the same health professionals who tell us, wash your hands with soap and under running water. Use hand sanitizer, do this, do that. So how is it that I come to the hospital. I'm there for 4-5 hours. I'm human. I'm drinking water. I'm eating, or I may have snacked or something. I would need to use the washroom.
That's right.
For whatever purpose. And then I get to the washroom. You know how that feeling is when you get to the washroom and you look at the thing and say, no, I'll hold on.
Yeah. Sometimes you can't hold on, but you think,
I say, no,
I can't
I'm
use
better
this.
off.
Yeah.
I'm better off holding on. Because
and even the holding on has its own problems. I like that you mentioned women as well.
Mm-hmm.
Trust me, you use one washroom and sanitary washroom for even 1 minute. Trust me, and the ladies listening know.
Yeah.
You go and buy medication.
Look, I took a trouble and bought what do you call it? Toilet seat sanitizers, the spray version for my mom, my wife, my sister, and a couple of female friends. Because even me as a gent, when I go in there, you are aiming and shooting, but Charlie,
the whole environment, you are itching.
No. And we seem to have normalized it. It must have a certain smell. It must be slightly dirty to be worthy. The hospitals out there where our leaders go, when they say, oh, this person is not feeling well, doctors have advised that we take them out on the medical, and then they fly them South Africa, they fly them UK, US, they fly them Canada. When they go to those places, is this how the hospitals look like? This is not how the hospitals look like.
That's right.
Here in Ghana, there are private hospitals that look very, very good. And people will opt for those private hospitals.
That's right.
Public hospitals, for those who can't afford the private hospitals, they usually go to public hospitals. But you find that the public hospitals have the best of professionals. Go and see the professionals at Kolebu. Go and see the professionals at Ridge or Greater Accra Regional Hospital. Even the TTH, go and see professionals there. But how it's a purely what happened is a purely management issue. Pure management issue. We've been joined on the phone line by Alassane Suyin, is a member of parliament for Tamale North. Good morning.
Good morning.
And thank you for joining us, Deputy Minister for Roads and Highways as well. Now, we saw you in a video with the Minister for Health in our beloved Tamale. And people are not happy about the video. What really happened?
Well, thank you very much, Johnny. You know Tamale very well. And so perhaps it will be easy to have this conversation with you.
Right.
So, a couple of days ago, there was an incident that led to the loss of life of a 31-year-old gentleman called Saleh. This prompted a social media campaign by some concerned citizens of Tamale asking for the TTH, that's the Tamale Teaching Hospital, to be fixed. And so if you go online and search, you will find fixed TTH in the trends.
Right.
This prompted the Minister for Health, Honorable Akando, to come down 3 days ago to assess the situation himself and to tour the facility to understand what other needs will improve, if provided, will improve the quality of health that is delivered at the facility. So I happened to be in town when he arrived, and I decided to accompany him to the hospital because it is one hospital that all of us, opinion leaders in Tamale and the representatives of the people, have received complaints and have even sometimes, endured some of the, misdeeds personally. So we all stand in unity to see how we can help retool that facility and reset it to provide the quality health care that it is supposed to provide to the people. So I decided to escort him because I have an interest. We got there. It was a surprise visit. The CEO met us, on the compound. The minister requested for a tour of the facility. Then we got to the emergency ward. The head of department was asked to brief the minister. Along the line, when the minister needed clarification, he sought the clarification. As and when he needed the clarification, he sought it. And so, I mean, it was going well until the HOD said that he did not understand why this matter was being blown out of proportion. This matter being the death of Salim. And that's when I stepped in to caution him to say, look, don't do that. Don't say that again, because one life lost is enough to be blown out of proportion so that other lives will be prevented from being lost. But unfortunately, he stuck to his guns and insisted that he said nothing wrong. I mean, the minister asked me to let go, and so we left. But whilst walking away, the CEO told the HOD to keep quiet, but he kept explaining himself that, he didn't say anything wrong. He doesn't see why this is being blown out of proportion. Then the minister turned back and came to him and said, my brother, we have told you to stop talking about this matter. We have offered you advice. You will not take it. It is okay. But you see, if you, speak to us this way as ministers of state,
right?
What it means is that the ordinary person may not even have, pleasant audience with you. You will not be patient enough to receive, advice or questions from the ordinary person. So let it go. And we left. Johnny, that is all. And later in the evening, the minister decided to, begin the retooling and researching of the hospital by firing the CEO. But the CEO is not the gentleman that we were seeing in the argument with. So this whole fuss have left me confused. I mean, I've seen the statement from the Medical Association, GMA, asking us to apologize. And I'm asking myself, apologize for disagreeing with a doctor. Like, because we are seen in a video arguing with a doctor, we must apologize to the doctor. We are not asking for an apology. We are the people's representative. We are not offended. He's not being taken through any disciplinary measure. We offered him advice. We refused. We disagreed. And we have to apologize. Like, so I have been asking, what exactly do they want us to apologize for? For arguing with a doctor. So if ministers of state cannot disagree with a doctor, a medical doctor, then we are all in trouble. Because we just disagreed with him that, look, don't say you don't understand why this matter is being blown out of proportion. Because one life lost is enough to be blown out of proportion for others to be saved. So when you say that, you will offend the sensibilities of people. Don't say that again. Insisted. And we left. And he hasn't been punished. He hasn't been transferred. He hasn't been asked to do anything. And it's not the CEO. I think that is where sometimes some people sympathize with the narrative. When it is presented as if it is the same CEO who was dismissed. The CEO is different from this particular doctor. So when the doctor say apologize, I want them to tell us what exactly. Is it something we said? Is it something we did? For which reason we have to apologize? Are we to apologize for going to the hospital on a surprise visit? Are we to apologize for arguing with the doctor? Is that what we are supposed to apologize for? Or then we say, I'm sorry, doc, that I argued with you. I'm sorry that I asked you not to say that the thing be blown out of proportion. I'm sorry that we came to the hospital without, notice. What exactly do they want us to apologize?
Well, as it stands now, the doctors are on strike. And I'm not sure they're returning anytime soon if they don't get the apology. So what do we do?
Well, I am sure that the Minister of Health is going to engage further and see how this will go. But I find it very unfortunate. And I think that, look, the opinion leaders of the region should not watch this to unfold the way it is unfolding. Trust me, because you see, the minister with passion came to see how he could help us resolve the problems. But if we allow it to go the way it is going, trust me, no one will show interest in that hospital again. And so those of us who have interest in the hospital working well to serve us must not allow this grandstanding and bullying, I would say, by this professional body. Because no one insulted them, no one have attacked any of them. So what is this about? Is it that we don't want the hospital to be touched, to be fixed? We don't want, the problems in the hospital to be solved? We don't understand. And I think the opinion leaders, the chiefs, the imams, must not see this as a Minister of Health problem or a Suhini problem. Those who want the hospital fixed must not confuse the issues. The minister's interest was to respond to their call to fix it. my decision to escort the minister was because we are determined to support in whatever way to fix the hospital. But if the doctors say we are too small to be seen arguing with them, we are too, small to pay them a surprise visit, and because of that, we should apologize and lay down their tools, and we all watch on. Then perhaps we want the status quo of the hospital to remain.
See, now, the doctors have also brought out a litany of items and machines that they do not have, which impedes the progress of their work. You are an MP for the area. Has these things come to your attention previously? Have people complained to you about the state of the hospital and what they can provide and what they cannot provide? Or is this just springing up because you and the Minister for Health visited the facility and they want to grandstand?
See, Johnny, the problem of the hospital is far, far bigger than the lack of equipment. During our visit, we noticed that an MRI machine that was provided the hospital has not been in use for over 6 to 7 years now. And worst of all, Johnny, we were told that at the time the MRI machine was provided, a similar one was provided from Fuanochi Teaching Hospital. Will you believe that the information we're given is that when the Fuanochi Teaching Hospital one breaks down and they need parts to fix it, it is the Tamale one that they come to remove parts to go and fix. Do you think that an effective management, Johnny, do you think an effective management would have permitted that? Don't you think an effective management would have rather also insisted that the MRI machine be fixed in Tamale instead of being used as a spare part to fix other MRI machines in other regions? Again, we noticed the endoscopy machine have been locked for over 5 to 6 years now without being put to use. In fact, it took them almost 30 or 40 minutes to find the key to open the room in which the endoscopy machine was. The mammograph machine was also locked away. Johnny, so it is not just about lack of equipment.
Right.
It's also about the management of even the little equipment that they have. The ventilator in question, we're told, for example, that even though they do not have enough ventilators at the red zone, at the emergency ward,
right,
they have a mobile ventilator at the ICU. At the time that the gentleman Salim got there, when we asked why they did not request for the mobile, ventilator to at least sustain the life of Salim until such a time that a bed was made available at the ICU, we're told that by the time they requested for the mobile ventilator,
right,
he had died. So, Johnny, it is not about the lack of the equipment, but it's even the utilization of the little that they have. And that is why it is important that we cut out the emotions, we cut out the tangentials, and we focus on the necessary things that have to be done to ensure that proper health care is provided for the people. And the appropriate working condition is also created for the health professionals who are dedicated and also willing to put up their best. It is not really against them. It shouldn't be. It shouldn't be. It is all of us for the improvement of the hospital.
Now, it does appear that the sacking of the CEO may have ruffled a few feathers, but will it change anything?
So the truth is that, and I think the minister himself knows that, it is not only the CEO who should be held responsible for the state of the hospital. I am confident that is not lost on him. But Rome was not built in a day.
Right.
But at least a journey of 1,000 miles will always have to begin with the first step. And so the minister talks that the first step was necessary, and the first step in this case was the dismissal of the CEO, so that other things that have to be done can also then fall in place. I do know, for example, that probably later today he will be back to the hospital again because he has mobilized some ventilators that he wants to present to the emergency unit.
Right.
So all these things are in the pipeline, and that is why, again, I'm appealing to the chief, the opinion leaders, the youth, not to sit aloof and think that this is a disagreement or a fight between the ministers of state and the hospital staff, and I mean, not even all of the hospital staff, some hard-working doctor who should... We all want those hard-working doctors to be given the conditions that they desire to put up their very best. But if they allow this bullying, this grandstanding by people who have other motives to succeed, the fixing of the hospital that they are requesting may not yield any, good results.
I see. Now, your people in Tamale North, I mean, our people, let me put myself in the equation now because it's my beloved Tamale as well. Our people, some may blame you and the minister to say that, look, it is because you came there, the doctors got angry, now they are on strike. We can't get doctors to take care of us. We have no alternatives. What do they do now? What message do you have for them?
Well, I think that is why I am inviting them to get involved. Because we came there, we did not insult any doctor. We have not disciplined or sacked any doctor. We simply had disagreements with them for, the choice of, a sentence. Because I insist, and I think that it was unfortunate for him to have suggested that he doesn't understand why this matter is blown out of proportion. Now, I don't understand why that disagreement with him is rather the one that is blown out of proportion. Johnny, so you don't understand why a life lost is blown out of proportion. But you can blow out an argument with you. You can blow that one out of proportion to even declare a strike. Do we measure in minors and minor in majors like this? You don't understand why a life lost is blown out of proportion. But because we argued with you on live TV, you can blow that out of proportion to declare a strike. Are you getting the double standard? So please, let's cool heads, prevail. Let us identify the issues that have to be addressed. And if we do, we realize that we will all be on the same side. And together, we will help resolve the concrete problems that the hospital face. And the people will be the better for it. And I am sure that is what this conversation is all about.
Alasan Suini, I thank you very much indeed for the time. His Deputy Minister for Roads and Highways is also MP for Tamale North and an indigene of Tamale, joined us here on Sunrise on 3FM 92.7. Helen, so you're not getting any apology.
I think that's also.
Get that straight.
I think that's unfortunate.
Because he wants to know.
Our Honorable is still tuned in.
No,
I know he's busy.
He wants to know what they are apologizing for. That's a fair question to ask. Yes,
it is a fair question.
So
to ask.
what are they to apologize for?
I think it looked like
that they visited the hospital unannounced.
But nobody's bothered about that. Let's not confuse the issues.
No. So he gave those options. Yes. That they visited unannounced, that they had an argument with the doctor, that they gave him advice and he refused it, that they moved on, have not taken punitive action against him.
It's not as simple as that. We live in a country where our doctors feel as though they are unappreciated, overworked, and underpaid. The way we handle our doctors...
That's a system.
That's the system.
It is not two individuals.
Fine, but when you go at a doctor like that, and you should see what doctors are saying today, it could have been handled delicately.
So the doctor said something that they thought as leaders that you shouldn't have put it that way. Because the doctor said the death of Salim, 31-year-old Salim, was being blown out of proportion.
That one I didn't hear. Honorable said I didn't
so he
hear
said,
it.
no, in fact, there's a tape there. The tape is there that he said he doesn't know why this is being blown out of proportion.
Okay.
Now, if I lose my relative and you tell me that I am blowing it out of proportion, I will not be happy.
Was
with
he
you.
referring to the death specifically,
Yes,
or was
yes.
he talking about how the conversation had gone?
So the death of Salim is what moved the minister to go
We
to
get
Tamale.
that. We get that.
So the minister was asking about Salim's death. The doctor says, why? You're blowing this out of proportion.
But that wasn't the first thing he said. Johnny, they went back and forth and back and forth.
Whether they went back and forth to 1,000 words, 2,000 words, you don't say in public, knowing that there are cameras there, that you don't say that somebody's death is being blown out of proportion.
I can agree to
That's
that.
not a pleasant thing to say.
I can agree
Literally
to that.
suggest that, people die here every day, so if your person has died, what's really...
That is not in good taste. That
It
I
is
can
not.
agree to.
So when he said that, the minister said, look, don't say that. He refused it, and he went ahead to reiterate that point, that it's been blown out of proportion. Adding, now when you say that, the ministers will also, they will go back and forth with you. Because, mind you, I said there are two politicians in the equation.
That's right.
Alasan Suini is member of parliament for the area. Minta Kando is a politician, member of parliament for Dwabosu. Right? They will certainly not be excited about, even if it's, because all it takes is one vote to win an election in this country.
That's right.
50% plus one vote.
That's it.
First past the polls. If I get one, somebody won elections with 3 votes. We've seen that before. So if somebody has died, already the family is agitated, and on camera, and it will be there forever. The record will be there forever. You will say, oh, you are blowing this death out of proportion. No, you can be the best surgeon, the best whatever it is. It was in bad taste. And if I were him, I would have taken a cue and said, oh, I apologize. It was a slip of tongue. You moved on. The moment you go back and forth, mind you, they are politicians first of all. And they have been told things by the people on the ground that the hospital is not. You heard Chris. So they will follow through with that conversation. That you don't even feel remorseful that somebody died in your hand. You get the point.
Even that for me was, at some point, the health minister said that the way you are speaking to me shows how you speak to the
Sunrise
patient.
on
That's a
3
bit
FM.
personal.
No, it is not personal.
I think that's personal.
No, but when you go on to say that somebody is blowing the death out of proportion, is that not
He
personal?
said that before that
yeah, but
came
I'm
in,
saying
no?
that when you talk about somebody's death being blown out of proportion, is that not personal?
Many things can be true at the same
I am
time.
saying that, is that not personal?
Many things can be
Then
true
when you say Helen
at
has
the same
died,
time.
and the father comes complaining, I
It
say,
is in government's best interest to engage with the GMA.
No,
Trust me at
no,
this point.
I am telling you that the GMA is grandstanding all of us because there are things that have been done wrong at that hospital, including a dirty washroom, which should not be the standard. And it is somebody who is a medical doctor who supervised the management of that rubbish. And they cannot grandstand all of us because they are doctors and nurses. No. We must tell them to the face that this is the quality we deserve from you. This is what we pay you for. People must be told, look, this whole conversation about this week, I've been on institutions. We get people paid for doing next to nothing. I have been in a hospital queue before where a doctor emerges from the consulting room and announces to everybody in the queue that Wapong doctor na beba nyumre no beba 4 or beba behwem Wapong yete ho Wapong. The GMA knows all these things. They've kept quiet about it. I'm saying that statement from the GMA talking about disrespect, what was the level of disrespect? Is the GMA not concerned about the fact that somebody's family member died and the doctor said it in front of everybody on camera that we are blowing the death out of proportion? Is the GMA not worried? Is that part of their Hippocratic oath? We must tell them to their faces that when you get it wrong, you have gotten it wrong. That's all. The minister may have gotten it wrong, but you also got it wrong.
That's all I'm saying.
All of you got it wrong.
That interaction yesterday or the day
So
before
if,
was
so if
not
you,
necessary.
so if you got it wrong, you are grandstanding the people say, I won't treat you again, blah, 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 blah. If I were the minister for health and I had the spirit of Jerry Rawlings in me,
hey,
if I were the minister for health, all those who say they aren't, I will sack them. There are people waiting at home to be employed though. There are nurses and doctors who are finished, who are waiting.
Johnny, you say they should stay at home indefinitely?
I am saying that there are doctors and nurses who are sitting at home waiting to be employed, who are asking for financial clearance, who are not getting. They are not tip on gossip people. If you say you are tired of the work because we complain that your washroom is dirty and somebody died on your hand and you don't feel apologetic about it, go home. We'll bring another set of people. Please. Today it's a renewed version. Come here.